Hello, my name's Aaron. This is my second video to do with microdiscectomy post-op. My last video I was quite tired, fair to say, so I do look like I'm about to drift off. But today feeling much better. This is day 6 of my recovery and I'm feeling great. I'm still taking painkillers, but I really don't think I need to. But the doctor's obviously quite keen to make sure I do take them. I think it's supposed to help as well as having to do lots of stretching and mobility, just to make sure I'm not shying away from it. But as I said in my last video, it went so well. I don't really feel like I've had surgery. I just feel like I've got an achy back. That's how great it went. So this is obviously at the moment I'm just still recovering. The swelling's gone down because it did come up for a day or two where it was like really uncomfortable to stretch, but I was icing it, which made it go down quite well, and I cannot recommend icing it enough. People, when they injure themselves and they get swelling, they ice it once or twice but can't be bothered to do it anymore. Ice it as much as you want. To be honest, it's not as if I've got anything else to do. I'm lying around. Making videos for YouTube is about as exciting as my day gets. So just stick some ice on my back whilst I'm chilling. Brilliant. It does a great job. And it's also going to help you recover. Means I can do stretching more and get going a bit more as well. I've been doing lots of walking. Try not to overdo it. I'm supposed to let my pain guide me. As I said, there's not much pain. The painkillers are hiding that as well. So I'm just going out for nice little strolls. Sometimes take the children with me. Obviously, it's good to get them out of the house too to come with me. Makes my walks a bit more interesting. It's very boring doing 10-minute walks 3 or 4 times a day. I mean, you need places to go. So no, I feel really, really privileged to actually have had this now. I don't have pain. Before I used to have pain, it would make me swear. I haven't sworn once since having this surgery. In the post-operative recovery period, just doesn't hurt that much. I feel very lucky in that, as some people do feel more pain depending on how the operation goes and what sort of pain you're in before. Like I said, I wasn't in the worst pain. I had a bulging disc. It was pushing, it was causing pain, was really annoying me, and was quite painful. But I feel like I can recover. I know if people have had worse pain, sometimes the damage can be a little bit more permanent, and can take a lot longer. My pain's gone. There's a little bit of sciatic twinge which I feel every now and then, which apparently is normal in this time. I'm feeling good. I got this corset on as well, a lovely black Velcro corset which goes around my midsection and that to really support my spine. I feel that I don't really need the support so much, but it does feel nice having that pressure holding you up. But it's to stop me bending and twisting. Not that I'd plan to do that, but we all know how you see something out of reach, you bend or twist to get it, and it's to restrict that movement and hold me strong, which is beneficial because the whole point of this time recovery now is even though I feel great and I could get back to exercise, there's a good chance if I put pressure on that disc, which they have operated on, there's a hole in it still, and it takes a long time to heal up, and so that could, under pressure, squeeze out again and push on the nerve, and I could be back in the same situation I've just been in. So it's important to let that recover. Apparently it could take up to 3 or 4 months for that to fully heal, which means heavy lifting, bending and twisting is going to be really restricted, and I'm going to make sure I'm not putting pressure on my spine for that amount of time, so I don't undo this good work. But I think that's an important thing to bear in mind, is even though I feel great, now I'm most at risk of doing it again, because I'm actually quite vulnerable with that disc, yet I feel great. So just going to have to wind myself back a bit there, although I want to get out and start doing some exercise and start doing something active. I'm going to have to be really careful. The good news is in a few days time I'm going to speak to the physio, which is quite an earlier appointment. It was going to be a couple more weeks, but I've managed to get myself an earlier appointment because I'm doing so well, because the procedure went really well and there was minimal impact on my life at the moment. I find myself just doing as I'm told, but I don't really feel like I need to rest so much. But I'll make the most of it. It's not often we'll get a chance to lie around doing nothing under doctor's orders. I had a wound check today, which they just basically make sure that my wound's healing well and I haven't got any issues with the site, and also just to check up on me as well, which was great for me to be able to speak to someone, because I mentioned in the last video how I had quite a stressful time. In looking back on the time now, I feel I was really rushed. I wanted to speak to an anaesthetist about what goes on in the theatre, what happens once I'm under. I wasn't aware of where I'd be going, who would be moving me around, who would be doing what happens to me. And I actually managed to speak to her today, and she went through it all in detail. And she explained to me how the general practice for them is not to go into too much detail, as a lot of people out there can get put off and get nervous. So I won't relay that information to you now. If you want to find out, just ask as many questions as possible and explain. If you explain it, it's to set your mind at ease, so you feel more comfortable with the procedure. They'll be quite happy to go into detail. I've asked so many questions, I feel like I could do the surgery myself now. It means that I want to know everything that went on in there and what happened to me. And I've stopped stressing now. I've lost so much sleep over it. Some nights I couldn't sleep. I'm taking sleeping pills, trying to get myself, trying to knock myself out, and I'd wake up stressed. But now, I don't feel that I was forced into something and that I didn't want. I feel now that I was put under a nice sleep whilst I was treated to a nice procedure which relieved my pain, and it feels like they did something nice for me now. Whereas before, it just felt like I was processed, like I was just something that needed to be done and get out of their way. But I feel much better about it now, and it's in my head has made me feel more comfortable, come to terms with what's happened. And that might not make sense to some people out there who, if you don't have concerns about going under general anaesthetic, you won't really understand. I mean, some of the things people have said to me of, oh, it's not that important, it's over and done with, you can forget about it now. That's the sort of things I would have been saying to anyone else who was feeling like I was feeling. And I do feel now that now I've expressed my concerns and I've had a chance to actually clear up the missing pieces of the story from when I was stressing about going under general anaesthetic, and then suddenly I'm waking up and stressing again. The bit in between now seems so boring actually, and uneventful, and just really set me at ease. And that's probably the most impacting thing that's happened to me, is more psychological. I've been offered a chance to go to counselling if I do still feel like I need it, but I feel great. And I understand now that obviously they weren't withholding information from me, or it's not they could be bothered to tell me. They just take a general line where they don't give too much information, so not to stress some patients who don't want to know details, they just want it over and done with. But me, I want to know everything, and I want to get involved. And so that has really set my mind at ease and given me a lot of confidence in the general procedure itself, and I fully recommend it to anyone out there. If you're in the sort of pain that makes you wince, that makes you swear, then this procedure is definitely worth going for. I feel great already, and it's 6 days into it. I've got a long way ahead of me yet, but feeling as great as I do now just makes me want to do more. Like I said, I got a physio in a few days, which is good. I've been doing lots of stretching. I find that I'm advised to mobilise that area quite a bit. It's just to make sure the scar tissue doesn't scar up around it. So I'm looking forward to being able to do new exercises rather than some simple stretches I've got. And I noticed there's a lot on YouTube, a lot of people who have done these exercises, and they claim that their quick recovery was doing all these exercises. And they said within a couple of months they were back to full fitness. Now, I find I've not been doing too much stretching. I think I'm supposed to do it 5 to 6 times a day. I probably do it 3 or 4 whenever I can remember, and I feel great. I feel like I could go to the gym now and carry on with what I was doing. So if these people a few months down the line are bragging about great results from the exercise they're doing, I think that sometimes it depends on how you are recovering, how the surgery goes for you, how invasive it was. Apparently, me being quite slim meant that the surgeon got to use smaller instruments and didn't have to poke around so much. So if that's something to think about, maybe if you are thinking of having the surgery, changing your lifestyle, trying to get a little bit healthier beforehand will probably make it a lot simpler and make your recovery a lot quicker. I'm very grateful for how well my surgery went, and I'm very grateful for the team who carried out the procedure. And I hope they're pleased with their job, because I wish I could make such a big impact to people's lives. So there you go. That's my update for now. Everything's great, and if you've got any questions, just send me a little message or leave a post on here, and I'm quite glad to answer them for you. And so thank you very much, and I'll probably speak to you in a week or so with hopefully some new news or update. Thank you. Bye.